Good afternoon, everyone, to another Shogun Europe webinar, this time supported by Trend and Amgen, and with a very important topic, breaking the silence, addressing mental health in Shogun's community. If you're going to have questions throughout the webinar, please use the Q&A box down below. You can also choose to have an automatic translation in your own language. The button is down below your screen. You will see a CC area, and you just have to select your own native language to get the webinar automatically translated. I'm Ana Vieira. I come from Portugal, and I'm a board member of Shogun Europe. I'm also a Sjogren's disease patient with a diagnosis for 17 years now. So it's been a long journey. And I'm now handing the floor to my colleague, Coralie.
Thank you, Anna. Thank you for the introduction. So my name is Coralie Bouillot. I'm a Sjogren patient. I'm also a board member of Shogun Europe. And I have been diagnosed now 12 years ago. Long journey as well. But after long years of diagnosis delay. And I'm very happy to be here today to address this very important matter with Dr. Al Friedman and our Lauren and Anjani from Trend.
Good morning, everybody. My name is Dr. Al Friedman. I'm coming to you live from North New Jersey, the United States of America today. I live in Chicago. I am a psychologist, and I specialize in supporting the needs of individuals and families affected by rare diseases around the world. I'm also a dad. My son, Jack, was diagnosed with a rare disease called spinal muscular atrophy in 1995, and he lived to the age of 26 with his condition. So I'm very interested and committed both professionally and personally to support the needs of families and individuals affected by rare disease. And I'm honored to be here today with Coralie and with Anna and with Lauren. And today, our goal is to begin a conversation about mental health and Sjogren's disease with the longer term goal of having this kind of discussion be something that happens on an ongoing basis so that all of you as community members can have the support that you need from each other and interacting with healthcare professionals like myself. The way our seminar is going to work is that Lauren is going to share some data from Trend that's been gleaned from social media conversations among members of your Sjogren's community. And this data touches on mental health challenges, emotional challenges, and symptoms of fatigue. And after Lauren shares that data, Coralie and Anna and I are going to engage in a discussion on these topics. And then we're going to leave about 15 minutes to answer questions that you have, having learned what we have to offer you today. So I'm honored to be here. Thank you for joining us. And with that introduction, I'm going to hand it back to Lauren to share some of the Sjogren's data from Trend.
Thank you, Dr. Al. Hi, everyone. My name is Lauren Doherty. I'm the Chief Operating Officer at Trend Community, and it is an absolute pleasure and privilege to be with all of you today. I'm going to take us through a little bit of data, as Al mentioned, and quickly get you back over to our wonderful panel to have a discussion. You've already met the speakers. We've already talked about the goals. So I'm going to tell you a little bit about Trend, and then I'll jump into the data. Trend is a community-powered data analytics company. We establish trusted partnerships with online communities, and then we have a technology that enables us with consent and privacy top of mind, allows us to unlock the conversations. And we focus on conversations and understanding communities of people living with rare and chronic conditions. Our whole goal at Trend is to really close the gaps in the medical and scientific understanding of these diseases to drive towards better outcomes and improved quality of life. So I now get to show you a little bit of the work and the data that we looked at and insights we uncovered in our goals of understanding the lived experiences of those with Sjogren's disease. So first, I will share a little bit about the mental health conversations that we learned about. When we looked on social media, specifically at Sjogren's community conversations, we found that almost 20% of those conversations are related to mental health topics. This is more than other rare communities, which I think speaks volumes that your community is already talking about these issues, which is a fantastic start. When we dove deeper into those mental health conversations, we did find that stress, anxiety, and depression were the top mentioned mental health symptoms. We will talk more about this with Coralie, Anna, and Dr. Al in a bit. I'm going to move on now. We also studied emotions. When we look at emotions, Paul Ekman back in the 70s identified 6 basic emotions. So at Trend, we often look at those. Those emotions are fear, happiness, anger, sadness, disgust, and surprise. And then one of the things about Trend that I value, and I think many people do, is that we can then look deeper and wider when we find something. So in this case, fear and worry rose to the top. So we dug in deeper around fear and worry, and we also found emotions like guilt, shame, regret, and embarrassment. These were very often talked about amongst people living with Sjogren's. When we probed further, and this is on the next slide, we found that when we looked further at fear, there were words like scary, symptoms like dry mouth, side effects, lip biopsy, joint pain, lymph nodes, pain, and eyes. So I hope that many of you that this is resonating. And again, we will be talking about all of this shortly. Just a little bit more on the data before I hand it over. We also, from working with many folks living with Sjogren's, we do understand that fatigue is very common. So we wanted to look at fatigue, and we wanted to look at fatigue through the lens of productivity. So when we did that, we saw that pain-like symptoms, various forms of tiredness, not just fatigue, but words like exhaustion, feeling tired, as well as dryness symptoms are most frequent. So then when we dove even deeper into productivity-related conversations, we also found that brain fog was very prevalent. And brain fog with professional activities coupled with the emotion of fear very much rose to the top. I'll give you a minute to read these 2 quotes, but these 2 quotes do highlight how challenging it can be, and in the words of Sjogren's community members, how difficult it can be trying to work and not even just hold down a job, but be productive in one's life while living with the condition. With that, that concludes the data portion. I'm going to hand it back over to Dr. Al, Coralie, and Anna to discuss all of this. Thank you for having me today.
And thank you, Lauren. Thank you.
Thank you very much, Lauren. That data is very helpful and really provides us with a nice and strong foundation for our discussion. So Coralie and Anna, let's jump into our discussion in response to what we just learned from Lauren and from your community who's sharing these conversations that lead to the data. My first question for the 2 of you is, why do you feel that talking about mental health is so important in the context of rare disease like Sjogren's? Why is it important to talk about mental health?
I would say, sorry to start early.
No, I was expecting it.
I would say that, first of all, because this is a very invisible disease, so you don't look sick. And most of us have been facing a very long, a very isolating patient journey. Many of us with a long diagnosis delay. And we've been, when we look back at our lives before and even after the diagnosis, we've been on a pilgrimage. I've used this term before, into different medical specialties, different doctors with disbelief, gaslighting you, not believing the plethora of manifestations the disease shows, many of the symptoms and specific ones, and the medical community overall not being able to connect the different dots. Would you like to comment or elaborate a little bit on this, Coralie?
Not that much, except one thing about the diagnosis delay. I have the feeling that this long diagnosis wandering leave scars to patients. I mean, sometimes, you know, having heard during maybe 10 years that your symptoms are in your head, at the end you finish silent. You don't talk about your symptoms anymore because apparently you're looking fine and you don't have any disease. So you don't say that you're tired, you don't say that you're in pain, you don't say that you feel dizzy, and you find strategies to avoid difficult situation. But even years later, after your diagnosis, you can't help yourself, and you always fear not to be believed. So it leaves scars definitely in patients' lives. And during this long diagnosis delay, patients at the end don't speak. But now it's time to speak. It's time to express the feelings, especially the difficult one, the mental health feelings, because I'm totally convinced that when you speak to other patients, you know that they know what you are going through, and you don't feel isolated anymore. You don't feel lonely anymore. That's why I think it's really, really important to speak together, because we are living the same thing. We are experiencing the same, as Lauren said earlier, the same fear and the same feelings.
Yes, I would only add that also, even after your diagnosis, mental health and your emotional health is very poorly addressed in clinical routine. And when it is addressed, it's most of the time it's too late. You're already in a very sensitive, delicate, fragile situation. So I think this should be addressed earlier in clinical routine to avoid complex situations where it will be very difficult to recover, or it would take much longer to recover from.
Thank you. It sounds like neither of you are surprised at the fact that almost 20% of the conversations on social media in the Sjogren's communities are about mental health and include mental health in the conversations. It sounds like that's not a surprise to either of you.
No, not at all.
Not at all.
Yeah.
I would like to comment as a professional that what you're describing, as I work with individuals and families affected by rare diseases, especially rare diseases that are invisible, not easy to spot. Like, I look at the two of you and I see two wonderful people. I don't see a rare disease. And when I have patients and groups that I work with invisible conditions, they often share some of the same feelings that you have shared about not being believed, about having many years before receiving a diagnosis. And those years do leave emotional scars is a strong word, but I can't challenge that word. It's a difficult journey. And I would also agree with you that mental health is often not addressed in clinical settings. My own son, who lived to 26 with a rare disease, was in clinical settings a lot of his life, 350 nights in hospital over 25 years. I don't think I was ever offered mental health support in those settings. So sadly, this is not unusual, but it's really important to be able to be heard, express how you feel, and have support. So everything you're saying is familiar to me in the work I do with rare disease patients all over the world. And I thank you for sharing. I'm wondering about the data that Lauren shared about the emotions that resonate with your community and their experiences. There was a lot of discussion about fear, worry, guilt, shame, regret, embarrassment. Those are pretty strong emotions, and they're not fun emotions to have. I wonder if you could talk about the different emotions you've each experienced along your journey as you think about when you were first diagnosed and the journey towards diagnosis, and the emotions you have now. How have things changed? How have they remained the same? And how have these emotions affected your relationships in your life with family, with work, with social activities?
Anna, if I may. Yeah.
Go ahead.
What doesn't surprise me is within the data Lauren presented is guilt, because I experienced it myself. After those 10 years listening to my GP saying that all my symptoms were in my head, when I finally got my diagnosis, I was like joyful. I said, yes, I've got something. And that's horrible when you think of it years later. And it's horrible to say, I'm happy because I'm sick. So as soon as I felt that joy, let's say relief, I felt guilty. And that balance between, okay, I've got something, I'm not crazy, because we are very lots among Sjogren patients experiencing that awful feeling to be just like crazy, and you feel at the end you feel happy to have your diagnosis, and that's guilt, definitely guilt to feel like that. So that was just my experience about the guilt, to feel guilty. And after, during your life, you feel guilty for all the things you can't do anymore, for your family, your kids, your work, and so on. So guilt is a feeling that never leaves any patient. So, and I don't know if you feel the same, but to me, guilt is every day in patient's life.
Yes, all the words mentioned by Lauren resonate in my own experience as a patient. And picking up on guilt, on the word guilt, I fully second your words. And it's something you carry throughout your life. I feel guilt because many times I should be the one caring for my children, and many times they are the ones taking care of me. And the same goes out to my parents. They daily committed to make my life easier. They are in their 70s, and I should be the one making their lives easier, not the opposite. And you feel guilty because you're not the wife your husband expected you to be. My husband walked away in 2020 when I started a clinical trial because he thought I was too obsessed with the disease, and he couldn't handle all the things that come with the disease anymore. And you feel guilt as well when you're not performing. I mean, in your career, in your employment, as you should or as you were able to perform earlier on. You know, the brain fog affects your productivity, your concentration, not to mention pain and many other symptoms. You find it difficult to deliver things on time, on the deadlines, and you see your coworkers looking at you because they don't see a sick person there. They see someone that looks lazy and keeps giving excuses based on the burden of the disease. And I think we live a very delicate balance, unpredictability, it's a very long word, is something that we carry every day, every hour. You know, chaos can erupt suddenly and with long-lasting impacts. So now I am okay, but I don't know how I'm going to be in the next hours or tomorrow or next week. So it's difficult to plan your life ahead. So I completely recognize every single of those words there. And I think most patients do, although the disease is very heterogeneous and it doesn't impact all patients in the same way. But I would bet that almost 100% of Sjogren's patients see themselves, recognize themselves in each one of those words Lauren captured from social media.
Thank you, Anna. Thank you, Coralie. This fear and worry were also, you've emphasized guilt in ways that I also hear about from many patients that I work with and serve. Fear and worry lead to anxiety, and fear and worry and uncertainty. You mentioned just now, Anna, this feeling of uncertainty. A lot of patients I work with experience that fear of what is going to happen in the future, not knowing what is going to happen in the future. Could you share a little bit about your own experiences with uncertainty and the kinds of uncertainty that you experience that lead to those emotions of worrying, fear?
Sorry, before
I
starting.
think,
Yes,
yeah,
Dr.
Cathy.
Sorry, before starting, if you can see, because I'm watching the chat, and you will see that
Yeah,
everybody agrees with, everyone agrees with what you said, Anna and Coralie. So sorry for the interruption, but it is impressive how they agree with you and how they have all the same feelings. Sorry for interruption.
Yes, thank you, Katie. About uncertainty, Dr. Al, I would like to say that it's not only one topic of uncertainty. There's multiple topics in our life, in our patient's life. Of course, the disease progression is uncertain because, again, it's poorly known disease. We don't know exactly what will be our tomorrow, just like Anna said, or maybe the following hour. But there's another uncertainty with the disease in general, is that you have to find doctors or specialists who knows the disease. You have to find specialists who believes your symptoms. Again, today in 2024, in major research center, some doctors are gaslighting patients when they tell they can give a couple of symptoms who might lead to mental health issues, but the doctor will say, oh, you're probably too stressed. Okay, so that is another uncertainty. You don't never know when you can share your feelings with your doctor. You never know if the doctor in front of you will dismiss or not what you are saying. So it's another, for me, it's managing the disease on a daily basis, not the symptoms, but really managing the relationships with the professional, healthcare professional, and so on. And that's something, again, which leads to stress, anxiety. One people in the chat was telling that before going to their healthcare professional, she couldn't eat anything and she was really stressed. So I think it's also be linked to uncertainty. It's not like a very common disease, very well known. I mean, tomorrow you can go to see someone, and that was my case last year in January, a very important hospital in Paris, Pain Research Center, so pain clinic. And the doctor told me, "You've got Sjogren's. Why do you come to the pain clinic? You only need an ophthalmologist." Okay. So I waited 6 months for that appointment, and I ended up with paracetamol and eye drops for my eyes. That's uncertainty, and that's Sjogren's disease. And that's very, very discouraging when you come back home and you have been again gaslighted and you finally want to drop everything. So that's not really stress, that's not anxiety. It's just you're tired of everything or struggling and fighting just to explain how you feel. So again, of course, physical symptoms are very much important, but we are now talking about mental health issues, and that's a huge factor of stress. I don't know, Anna, if you will share my opinion on that, but
Absolutely, Coralie, absolutely. I can tell you that the doctor who diagnosed me 17 years ago believed Sjogren's wasn't much more than dryness, dry eyes, dry mouth. So for 10 years, he didn't listen to my other symptoms and complaints. He kept saying that's not Sjogren's related. So after 10 years, I almost wanted to give up everything. And then I found this nurse who was in a safe zone. So she listened to me, and she was the one pushing for me to find another else professional who would listen to me. And she helped me find the right one, the one I'm still being followed up until today. So this uncertainty of the different medical specialties that we need to see to have proper care and proper quality of life generates really a huge amount of uncertainty, because not all of them, and I think it's the same across all rare diseases, they don't see rare patients every day. So it's difficult to find those who understand the disease, and this generates much anxiety and stress and leads to depression if you're in the long term, I would say. Another thing is, Sjogren's is a immune-mediated disease, and you suffer from chronic inflammation. And chronic inflammation in itself, it's a neuron killer. It generates anxiety as well. So the disease itself, even if everything was just perfect, causes anxiety. So there are so many layers of stress and uncertainty that it would take us much more than 100 webinars to explore everything. But yeah, I fully second Coralie's words.
Well, thank you both for sharing so openly. Sadly, this is not unusual for me as a psychologist to hear from patients with conditions that are rare and invisible to the eye. And it's very important for all of us to find doctors who listen to us and are open to learning. Personally, I didn't have this challenge because my son used a wheelchair, so it was a very visible condition. No one ever questioned whether my son had a problem. What I'm learning as a psychologist these years is that the amount of stress is really high for patients like you, Coralie, and Anna, whose conditions are not visible to the eye. It's a significant stress, and it leads to a lot of these feelings of frustration amongst the patient population I serve. I'm wondering if we can shift gears, given all these challenges that are real and that your community feels and that you feel, what have you found helpful? What approaches have you taken that you found helpful as you manage all these challenges and the emotions that come along with living with the condition like Sjogren's? what's the solution to this problem from your perspectives in terms of what you can control? There's a lot we can't control when we interact with the doctors in the healthcare system. We can't control certain things about our condition and its symptoms. We can't control how we respond to all this. What have you done that's helped you to manage the emotions that you feel?
Well, I saw one of your colleagues one day, a psychologist, because I wanted to speak to a professional to try to help me managing the condition. And he told me one thing which has really, really helped me. He told me, you haven't asked for this disease. You're not responsible for being sick. It's the reality for you. Now you just admit that and you do what you can when you can without any other question. And it was really helpful for me to understand that I can't be anymore the lady I was before being sick. And I maybe a little bit accepted the disease and the limitation that the disease made to me. And that was just one advice. And again, it was a long time ago, but I remember it's not my fault at the end. So, okay, I can't do that. I can't do this. I might not be as present for my kids as I would like to, but that is it. And I can't do anything I can't do anything else. So that was one advice that I kept, and I still think of that psychologist often, just to remind myself that it's not my fault. I don't have to, again, to feel guilty. And if I need to rest, and if I need to stop, and if I need to do it, I just need it and I do it. So it was a bit of advice, but.
Thank you, Anna. Thank you,
Well,
Carly.
Yeah. Well, this is a life-changing disease, and it's like a new biography. You know, you need to rebuild a new you to adapt. And what I first tried to was to reach out to my peers, to other patients, to a patient organization, because they would listen. They would not. They would listen without commenting. You felt safe there. It's like they become a new family. Like family members. And that helped me a lot, understanding that I wasn't the only one going through that, through all that tsunami of emotions and difficulties and challenges. And they have taught me to become my own self advocate. So I've learned much more about the disease, and knowing more about the disease, it's empowering. Not only helps you to self-manage and to self-care for yourself, to learn to pace yourself, learn to rest, but not to give up. But even though that was not enough for me, and it was not until 1.5 years ago that I needed to find specialized help. And I mean psychological therapy and a psychiatrist. So I'm medicated from 1.5 years now. And I just feel that it's sad that I didn't do it much earlier, because my quality of life improved dramatically. And I now know better how to live with things I can't control, and a better patient advocate as well. I can help others much better than I used to. So I think that if we can get specialized help earlier and have our doctors guiding us in this journey, our quality of life can improve dramatically. So it's sad that I haven't done it much earlier. I would say more than 10 years ago. I would be a different me today, for sure. But I'm happy I've done it. So better late than never.
Thank you. Thank you both. As a psychologist, I'll tell you that people don't reach out and call me until things get bad enough. And what I mean by that is somebody could have, would have, should have reached out for help a year or 2 or 5 years before they do is normal. That's with or without a rare disease. So that you're right on schedule, Anna, in the context of rare disease. You both said some really important things. One is, Coralie, the idea that it's not your fault. Having a medical condition is not a reflection on a person's character. And whether the person has a rare disease or not, if they have a medical condition, depression, anxiety, a rare disease that brings on these feelings, this is not a character flaw. This is not a reflection of you as a person. This is a medical condition that's interfering with your quality of life. That's a very important point. And second, Anna, I really love the concept of a new biography. The life that we thought we'd have, in my case, the child, the baby I thought we had, wasn't what we expected isn't what we find ourselves with. Our life is different than we expected. So that concept of writing a new story, a new biography, making that change of expectations is hugely important, and reaching out to others in your community is hugely important. Like you, the support group for my son's condition has become an extended family and will be for the rest of my life, even without my son's presence. So that support network that you have from family, from friends, and especially your community is vitally important. And I'm really glad you have that support with this community, which is why we're doing this webinar today, to help strengthen and support the community that you're a part of. Just another, I want to shift gears quickly before we take questions. We have a couple minutes. The data talked about not only fatigue, but also pain and brain fog that affects people's productivity and brings about more emotion of fear and worry, especially with work. Let's just, for a few minutes, for a brief time, I'd love for each of you to talk a little bit about fatigue, brain fog, and how those symptoms have affected you. Are you familiar with those symptoms? And what has your experience been with managing these challenges that also come with Sjogren's?
Well, I think, and probably my fellow Sjogren patients will think the same. These symptoms we are talking about are, to me, like a vicious circle, because we don't know exactly. By example, for brain fog, Anna said earlier it was probably linked to inflammation, but we probably can identify some triggers for individually. I know, by example, if I'm in a very noisy environment, like a restaurant or something, speaking face to face with a friend, I know that brain fog will hit me very badly. So I identify a couple of things. But I would like to emphasize the fact that all these symptoms are kind of vicious circle for me. Pain, brain fog, fatigue, they are linked all together. And I think it's really the worst part of the disease, because it's symptoms that nobody can manage properly. We don't have any treatment to manage them. We don't have to need anything to help with that. And speaking of productivity, I have been put in disability at work. I was 46, meaning that at 46, the society thought that I was not able to work anymore. That's why I volunteered. But brain fog can be really, really dramatic when it comes to work, because you can have kind of blackout from 1 minute to another. It's pretty difficult to explain that feeling, that sensation of brain fog. But that's, for me, brain fog, fatigue leads to pain, leads to depression and anxiety, leads to more brain fog and more pain and more anxiety. And that's really a vicious circle, which honestly, for me, it is the worst part of the disease symptoms. Even if the pain can be manageable, but the rest can't be manageable. From my point of view, I don't know, Anna, but I think we might be a lot to think like that.
Yeah, I agree. And particularly at work, I find it difficult to start things, sometimes difficult to end things, and, slow thinking, difficulties in concentration, wanting to verbalize things and not finding the words, regardless if you're writing or speaking, and sometimes it's embarrassing. And at work, it does generate a lot of fear, as will I be able to keep my job for how long? Because sometimes it's really disabling. You just can't find the strategies to fight against it. So it's frightening sometimes. And I live with brain fog for I can't remember since when. I think it's been there always, in different levels of intensity, from disabling to very light one to I can't even verbalize how it is. I find it difficult to express it.
Have either of you found anything helpful in terms of strategies? I respect how challenging it is to have symptoms like this that are intrusive and interfere with your day-to-day functioning. Have either of you found strategies that work for you, and any suggestions you've had for the community?
Well, I think it's really personal, but my strategy, which seems to work a bit, is to change activities and alternate activities all the time. But again, I'm not working anymore. I'm volunteering for Gren Europe and for other organizations, but I will alternate. By example, after this webinar, I will close my computer, don't look at my phone, otherwise I will feel dizzy because I spoke, because I have been concentrated during 1 hour speaking in English, which is not as you heard, my native language. So I will close the computer and I will do something that doesn't need to, well, let's say, use my brain. And same for the physical pain. If I do something physical, which will lead to pain, I stop and I do something more calm. So that will, my own personal strategy to try to cope with symptoms is changing all the time and regularly the activities, alternate the activities. And that will rest my brain and sometimes rest my body. And after that, I change, I permute. I'll try to find a balance like that. But again, I can do that because I'm not working anymore 8 hours a day behind the desk. But maybe for me, it works a bit.
Yeah,
Thank you.
I'm working from home, so I can also alternate, just like Coralie mentioned, and changing the activities. It does work for me as well. Just like Coralie said, intercalating activities with those you don't need to use your brain, like doing some house chores or cooking or ironing, things you do almost automatically without needing to think. Learning to pace myself and to rest, learning to say no, so don't take more than you can handle. sometimes it's not easy to manage this, but it helps. And exercise also works for me, not only for fatigue, but also mental health. It has been helping me a lot, exercising regularly.
Thank you.
Exactly, totally, Anna. Yeah.
Yeah, thank you both for all of what you've shared. And I can tell you exercise always helps. Whatever exercise a person can do, whatever their situation, always helps. It helps me too when I'm able to exercise regularly. We're going to, so thank you for everything you've shared. We're going to shift to some questions, and I can tell the chat and the Q&A has been very busy. I haven't been able to monitor it while facilitating. But before we move to questions and answers, I want to thank you both, Coralie and Anna, for sharing so openly and so honestly in this forum. I work with lots of patients in private therapy sessions and in semi-private group support group sessions. This is a recorded webinar that's made public to your community. And I want to commend you for having the courage and the strength not only to manage the condition, the medical condition of Sjogren's, but the strength and the courage to share so honestly and openly with your community is to me very special and unusual. And it's a lot of strength and courage and leadership to put yourself out there in the way that you have today. And I appreciate it. I do lots of work around the world with rare disease, and this is an unusual conversation to have in a webinar format, and I thank you for it. Let's move to the questions. I'm not sure exactly who's going to pose them to us, but there are a whole lot of chat and a whole lot of questions. And we've got about 10 minutes to receive whatever questions have come in. We won't have time for all of them, but we'll do our best to respond to as many as we can in the time remaining.
Well, I will start with one in our Q&A. This lady says she has scriptophobia as well as social anxiety. She has panic attacks while writing and speaking publicly, and she wonders how will she be able to manage it, because she's really worried about this.
Well, I would hesitate to give a specific answer without knowing a person and evaluating the person's need, but it sounds like these symptoms are interfering with your day-to-day functioning, and it sounds like it's hard for you, Yrsa, to figure out how to manage these symptoms that are so intrusive. So I would encourage you to reach out for help anywhere you can find it with any professional, a mental health professional, counseling professional, or a medical professional who first will listen to you and take your concerns seriously, and then offer you some support to help get the panic attacks under control. Panic attacks are very powerful symptom and very intrusive symptoms, and they're scary. And I take that very seriously. So you want to find somebody who can help you get that intrusive symptom to soften it and to get it under control. That might happen with counseling, and it might happen with medication, and it might happen with a combination of the two. But I wouldn't want to go any further without learning more about you, Yrsa. Thank you for the question.
Another question from someone who said that our experience is that doctors do not understand that brain fog and physical fatigue. And they always think that it is the other way around, that depressed people become having fatigue. How do you tackle this? That's interesting.
It's an interesting one.
Yeah.
Yeah. Coralie, Anna, do you have any thoughts about this? This is a good question.
By raising awareness about that particular disease, I guess, because we all know that we see healthcare professional who doesn't perfectly know Sjogren's disease. So with your help and that Lauren and Trend and Amgen webinar, we will manage to make healthcare professional understand that we are not depressed. We are not sick because we are depressed. It's the other way around. I mean, we might feel depressed because of the disease, but we don't have the disease because we are depressed. So
Yes.
that's my feeling, because again, we struggle with that as patients every
Yes.
single day.
Yeah, we need to raise awareness on the topic. If you want to be listened, you need to make some noise. And that's what you're trying to do today, making noise about this very important topic. So that's
Yeah.
what all of us patient advocates
Yeah.
try to fight for.
Unfortunately, in rare disease, it's often the case that we know more than the doctors because the situation is unusual to the doctors and they haven't necessarily learned enough about it to understand it to the depth that we wish they would. That's true with many rare diseases. In this particular case, Jane's question is observation and question is really an important one, because as a practitioner, what I can tell you is that every patient who comes to me, is a new experience, and it's like a treasure hunt with clues for me. And my job is to be a detective and to understand the clues in the treasure hunt to make sense of them. And oftentimes it's the chicken and egg. Which comes first, the chicken or the egg? Because people don't fit neatly into categories in mental health. Many people have more than one symptom or one symptom that leads to another symptom. So I think the most important thing to do, Jane, in this case is to find doctors who will listen to you and will take the time with you to hear the sequence of how these feelings emerge for you and how these symptoms emerge for you. Which comes first, the chicken or the egg? And if they don't understand that sequence, unfortunately, it's up to us to teach them that sequence and to take that sequence seriously. So whatever the specialty of the doctor is, whether it's a medical doctor or a psychologist or a mental health professional, you want somebody who's open to learning and open to listening, because the process for you and with these symptoms may be very different than what they're used to. And you're welcome. And it's unfortunate that we have to work so hard to teach our doctors, but in rare disease, that's often the case.
Indeed. Another question here, which I think is a broad one, but very important, is what criteria should we look for when seeking a mental health professional as someone who has Sjogren's? I mean, what are the red flags? When shall we ask for help?
So, this is a good question and good one to end with, if time isn't available. So when does someone need to reach out for help? The answer to that question is, and I think I might have said it in a different way earlier, if the mental health symptoms you are experiencing are interfering with your day-to-day functioning at work, with your family, if symptoms are interfering, if it's hard to eat, if it's hard to sleep, if it's hard to think clearly, if it's hard to do your work, if the symptoms are intruding and interfering with your day-to-day functioning, that's the cue to reach out for help if you can't solve that challenge yourself. In terms of how to find somebody, optimally, you would find a mental health professional who knows something about Sjogren's disease, in this case, somebody who has experience with other patients professionally with Sjogren's disease, and somebody who can draw from that experience to help you. Unfortunately, that's going to be a tall order to find somebody who has that experience, because Sjogren's is not rare to you and to me, but it's rare to the average professional out there. So if you can find somebody who has experience, and oftentimes people find professionals in rare disease, people find professionals by asking each other who has helped you. That's a gift if you can find someone previous experience. If you can't, it doesn't mean you should rule a practitioner out. What it means is that you need to ascertain whether that therapist or professional is open to learning, is willing to listen, is open to learning, is willing to read about the condition and learn from you and learn with you. It's a disadvantage to not have any experience when I help a new patient with a new disease, because I don't have a basis of comparison. but it doesn't mean a person in a mental health role can't be helpful. I think in a previous conversation, Anna, you said it all comes down to listening. You reminded me of something I already knew. I'm not an expert on Sjogren's. My learning curve is steep. I've learned a lot from the two of you since getting to know you, and I will continue to learn. And I like to think I'm open to learning. Some are, some aren't. Some are too busy, and some don't want to bother. But there are those of us in the field who are willing to learn and are open to learning. And it's more likely that that professional will be open to learning if they have the time and if they have some reason to be interested in something new and different. Because of my son, I am highly committed to helping people in unusual situations, but there are not a lot of people. I'm looking for a company if you know any good professionals who fit this description. So I hope that helps as a start.
Thank you so much, Dr. Hall. I just wanted to add something to our fellow Sjogren patients, and I think it might be the one of the final take-home message. Don't stay alone. Don't stay isolated. I mean, there's patient association in every country, as a Sjogren patient or an umbrella organization, where you will find help, you will find support. Maybe you will find some psychologist specialized in a rare or rheumatic condition or neuro condition, whatever. But please join your national patient association. You will find some support there, definitely, from people just like Anna, me, and many other fantastic people in patient association. We feel the same. So we can share, we can support you. So don't hesitate to join your national patient association.
Yes, I will just leave a sentence that I've learned from Dr. All that I found it very, very useful. So always remember that you are not crazy. The situation is crazy. So don't feel isolated and reach out for help with someone who listens.
Yeah. Thank you, Anna.
Dr. All, thank you so much. We need
Yeah.
to end on time because there
Yeah.
are other commitments, unfortunately.
Yeah.
Otherwise, we would have many questions to answer and a lot more to learn. Maybe we can organize another event in the near future. Thank you so much also, Lauren and Anjani, for all the support. We will be forever grateful and for bringing this topic into the spotlight most of all.
Yeah. And I thank you. And I'd like to finish by echoing what both Carly and Anna have just said. You are not alone. There is strength in numbers. And I can tell you, as a dad of a young man who lived to the age of 26, I found as much support or more support from the community that I belong to and others who face similar challenges than from any mental health professional. I'm not saying that a psychologist can't help you or a mental health professional can't help you. They can. But as I do the work I do in rare disease around the world, I'm seeing much more power in numbers and strength of community, which is why support groups are so important and why communities like yours are so important and why I'm committed to supporting educational opportunities and webinars like this one. You should all stick together. You are not alone. And I'm grateful for the opportunity to support your conversation today.
Thank you so much. Thank you.
Thank you.
Thank you so much, everyone. Bye-bye.
Have a wonderful
Thank you.
day.
Have a
Bye.
wonderful
You
day
too.
too. Bye-bye.
Thank you.